Plaque radiotherapy is used to treat many different eye conditions. It is also known as brachytherapy or surgical radiotherapy. In most cases, it is used to treat cancer. An eye plaque is a small disc containing a radioactive source. It delivers a high dose of radiation to the affected part of the eye, but very low levels of radiation elsewhere. The treatment involves 2 operations. The first is to fit the plaque to the surface of the eye. The second operation, which proceeds a few days later, is to remove the plaque. Between the operations, patients are required to stay in hospital. Your eye specialist will discuss all the available treatment options with you. Your treatment decision should consider risk of tumour spread, potential side effects, and quality of life after treatment. Compared to other treatments, such as removal of the eye, plaque radiotherapy is equally effective at minimising spread of the tumour. For about 90% of patients, this treatment successfully destroys the tumour in their eye. The following side effects can sometimes occur with plaque radiotherapy. Some patients experience a loss of vision. The risk and amount of vision loss depends on the size and location of the tumour. Double vision can sometimes occur after surgery if an eye muscle needs to be moved to place the plaque correctly. Usually this returns to normal within a few weeks. A dry eye or a cloudy area in the lens of the eye called a cataract can occur in some patients. This is more likely if the tumour is near the front of the eye. As with any surgery, complications such as infection can also occur. The risk of these side effects varies from person to person, and these variations can be explained by your eye specialist. Before the operation, drops will be put into the eye to make the pupil larger. Local or general anaesthetic is then given. The operation to insert the radioactive plaque usually takes under 1 hour. The surgeon will begin by pulling back the eyelids to access the eye wall overlying the tumour. The eye does not need to be removed from the socket. Specialised equipment is used to see exactly where the tumour is and mark its location on the outer layer of the eye. The plaque is then placed in position over the marked area and attached with surgical stitches. In some cases, a small sample or biopsy of the tumour will be taken during the operation. Testing this sample can help confirm the diagnosis and direct future management of the tumour. The decision to take a biopsy depends on the size and position of the tumour. The length of stay in hospital between insertion and removal depends on how long the plaque needs to stay in the eye to kill the tumour cells. This is typically 1 to 7 days, but depends on the tumour size, location, and plaque type. The amount of time required is calculated by radiation specialists called medical physicists. After the first operation, you may feel like there is an object in your eye and some slight discomfort. You'll be offered pain and nausea medication if needed. It may be uncomfortable to read books or look at screens. Audiobooks, podcasts, and music can help pass the time. During your hospital stay, you must stay near your bed as much as possible. This is to minimise the radiation exposure to others. For this reason, you will either be in a room on your own or sharing with another plaque radiotherapy patient. You will be allowed visitors, but they will be asked to sit a few feet away from you and to minimise their visit time. Children and pregnant women should not visit whilst you have the plaque in place. Your balance and depth perception may be affected. However, you should try to keep mobile within your room. When lying down, you should avoid lying with your affected eye on the pillow. The second operation is to remove the plaque and usually takes about half an hour. The timing of the operation is based on specific radiation calculations. For this reason, it may happen outside of normal operating hours. Once the plaque is removed, you will not be radioactive. Keeping away from others is no longer required. After the plaque is removed, your eye will feel sore, bruised, itchy and weepy. Nursing staff will show you how to apply antibiotic and anti-inflammatory eye drops and give advice about pain relief. Patients can usually go home on the day that the plaque is removed. In the 2 weeks after surgery, you should avoid rubbing or pressing on the eye and avoid heavy lifting and strenuous exercise and activities such as gardening. You should try not to get soap or shampoo in your eye. Do not wear eye makeup. And continue your medication, eye drops and cleaning routine as advised. To wash your eye, gently wash the outside of your eyelid with warm water on a clean cloth. Move the cloth from the inner corner, close to your nose, to the outer part. Side effects such as irritation, redness and double vision usually settle in the weeks following the treatment. Blurring and dimming of vision may develop in the years following the treatment. How likely and severe these side effects are depends on many factors, such as the location and size of the tumour. Contact your treating hospital if you experience severe or unexpected side effects. Tumours usually shrink gradually or stop growing in the first few years after treatment. Most tumours shrink to about 40% of their original size. Your tumour may be controlled even if it does not shrink. How soon you can get back to normal activities will depend on several factors. Ask your eye specialist when you can resume work, driving, swimming, and other activities. You may feel low in mood at times after you have been discharged from hospital. Discussion with family, friends, your healthcare team, your GP or a counsellor may be valuable. You may feel quite tired for a few weeks following treatment. You will have a review appointment a few weeks after your surgery. The clinical team will examine your eye and discuss your medication and eye drops. You will then be given appointments every 6 to 12 months. Lifelong follow-up is generally required.